seconds, it'll be going.
We're good. We are going to call the special meeting for Akron City Council to order. Today is April 20th. We're going to have the clerk to read the roll.
Baylor? Aye. Connor? Aye.
We're going to have the clerk to read the roll.
Freeman?
Aye.
Fusco?
Aye.
Kamer?
Aye.
Lombardo?
Aye.
McKittrick?
Aye.
Malik?
Aye.
Neal?
Aye.
Mobian?
Aye.
Samples?
Aye.
Somerville?
Aye.
Swirsky?
Aye.
All members are present.
Thank you. In order for us to conduct business on this evening, I'm going to ask if we can please have a motion and a second so that we can suspend all council rules that requires us an in-person meeting and in-person voting. I'm going to actually ask if Councilman Fusco can make that motion for us.
Yes, I move that we suspend the rules as mentioned by you, President Somerville.
Wonderful. Councilwoman Samples, can you second?
I second that motion.
Okay, so we have a motion and a second. All in favor? Again, we're going to do roll call.
Baylor?
Aye.
Connor?
Aye.
Freeman?
Aye.
Fusco?
Aye.
Kamer?
Aye.
Lombardo?
Aye.
McKittrick?
Aye.
Malik?
Aye.
Neal?
Aye.
Mobian?
Aye.
Samples?
Aye.
Somerville?
Aye.
Swirsky?
Aye.
Motion passes 13-0.
Thank you. We will also need to pass a motion suspending all council rules that requires that legislation first be considered by committee before presentation and consideration by council. Councilman Fusco, can you give us a motion?
So moved. I'd like to recommend that we suspend the rules, reference the requirement that we have a committee to consider legislation, and that we just address it this evening.
Okay, thank you. Councilman Kamer, can you second that motion?
Sure, I'll second that motion.
Okay, thank you so much. We are actually going to take one item out of order. We do have, and we want to thank her, we do have Donna Skota, Summit County Public Health Commissioner with us this evening, but we do have Mayor Horrigan who has a resolution, which is actually item number 1. We're going to take item number 1 out of order and address that first because he does have another meeting that he must attend. So I'm going to ask if the clerk can read in item number 1.
Item number 1, offered by Mayor Horrigan. Resolution strongly urging the passage of the proposed interim supplemental congressional bill, which would provide $53.55 billion in emergency financial assistance to cities like Akron on the front lines of the fight against COVID-19 to ensure they are able to continue to provide direct public services and maintain safe, healthy, stable communities, urging measures to address shortages in PPE, urging the funding and practice of universal testing for COVID-19, and expressing the need for additional measures to provide assistance during the COVID-19 crisis and declaring an emergency.
Mayor Horrigan?
First of all, thank you. Hopefully everybody can hear me okay. If you can't, just kind of signal with a wave. I trust all you are staying safe and staying home. I know we see a lot of media presence out there about the effects on cities across the country about what this pandemic has. It's not even across the country, it's across the globe. And mayors across the state of Ohio and the country, there's about over 2,000 cities that have been lobbying the federal government for direct assistance. And you see a lot of federal care packages coming out, significantly helping businesses, which we've supported, significantly helping in the unemployment line, which we've supported. In cities across the country are going to face a serious gap in some revenues and how they provide those services. So we've been working fairly hard with the governor's office, who's been very supportive of us and of mayors across the country. So if you look at the resolution, and as those monies have come out previously, they've been in for direct things and very specific things, which are not allowed to be used for a little bit of leeway in how we can spend some of those monies. And so in support of that resolution, we're going to need some direct federal assistance because there are cities across the country that are dealing with, and in just a couple of examples, the city of Los Angeles is facing almost a $600 million hole. The city of Detroit is probably close to a $400 million hole. It's not a city that's not going to be affected by this. There's not services across our city that's not going to be affected by this at some particular point if the federal government doesn't give us some sort of help. So we will do our due diligence to do what we can to be able to do that. But like I said, your support on this resolution is going to be key because we are forwarding them all and they do respond. And each one of our federal representatives, some have been more supportive than others, I'll be honest, in what that's going to look like. And there is money flowing to the states, but those are going to have restrictions on it too. And we need some language in some of these bills to be a little less restrictive so we can be able to meet those needs on those key city services. As if many of you have come in, many of you were elected in 08 or 09 or a little bit before that had been around. You saw what happened to cities across the country with the recession. And this has the effect to be a lot worse than that. And so we're lobbying fairly significantly with the White House and with the federal government to be able to provide direct assistance to cities. So it's fairly straightforward, and I'd ask for your support. So I thank you for giving me the few minutes. I hopefully all, like you said, you guys staying safe and staying home. And as we start to roll open the city at some particular point, it'll always be guided by data and by science and by healthcare experts. So thanks for taking the time to listen. And if you ever have questions of me or where the city is going, please don't hesitate to text or email, and we'll get back to you as quick as possible. So stay safe and stay home. See you soon.
Thank you, Mayor Horgan. Do we have any questions or comments from any council members at this time? Okay, if there are no questions or comments, Councilman Fusco?
Yeah, I'd like to make a motion to approve with suspension of the rules. I'd also like to request that this be council as a whole, as well as mayor and council as a whole.
We have a motion on the floor. Councilman Malik, will you second that motion?
Yes, seconded.
All right, thank you so much. Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Passes 13-0.
Okay, thank you. I did ask our Summit County Health Commissioner, Donna Skota, to please join us on this evening so that she might be able to give us an update on the COVID-19 pandemic here in Summit County. Donna, can you hear us?
Yes, can you hear me?
Yes.
Yes.
Okay, great. Thank you for the opportunity. Do you just want me to go ahead and get started, Margot?
Yes, please.
Okay. I just thought I'd give you a brief overview and tell you kind of where we're at from a response. And then we can hopefully entertain any questions if you have them. Currently in Summit County, we have 371 confirmed cases of COVID-19. And currently hospitalized out of those cases are 92 individuals. And 54 of them reside in long-term care. We also have been looking at the numbers and trying to get better data, because what happens, and just so you understand, this is a Class A reportable disease. So what that means is when an individual tests positive, we get information put into an ODERS. It's called ODERS, but it's the Ohio Disease Reporting System, and it's online. And depending on who's doing the data entry, that depends on how well the data is collected. So sometimes things like race, age, where they actually live, because hospitals sometimes have an old address on somebody. So what happens is it takes us about 24 hours to track down where that person really lives. So the data's kind of been a moving target, but what we've been trying to do is go back through all of these cases using, working with the hospitals or wherever the person was tested at, and try to get better information so that we can have a more complete picture. Currently, right now, all of our Black cases in Summit County, the percentage is about 29% of our cases. White is about 54%. And then unknown, we've been able to get down to about 8.6%, which has been good because we have to make all this, literally, it's kind of the detective work to find out who these folks are. Within Summit County, we've done a good job. I mean, I forgot to tell you, confirm today the number of deaths in Summit County. We had 24 deaths total in Summit County since this all began. And actually, it's actually 27. It's 24 plus 3, so it's 27, I'm sorry. So we've had 27 deaths in Summit County and 100 healthcare workers affected. So what we're currently doing, because we know COVID is here, we know there is wide community spread, we also know that there is a certain group of individuals that is totally asymptomatic and is walking around but may have COVID-19 and spreading the disease. You are most susceptible, you are most contagious with that disease around that 24 to 48 hours if you start to show symptoms. And when I say show symptoms, it can be as little as a headache, a dry cough, maybe some intestinal issues with some diarrheal disease or some, not just feeling right, and then it goes away. And those individuals, because of their work as either a first responder or a healthcare provider, end up getting tested. And we find out that they had not really any significant symptoms like you think. And then they end up, and most of them never end up in the hospital. In fact, it's important to remember that about 80 to 85% of all individuals recover from COVID-19 on their own. It's that 15% that requires far more significant medical interventions and resources to be able to make sure that they are able to get well as well, within recovery. Now, two of the biggest hurdles for everyone has been the availability of PPE, personal protective equipment. We have had all of our strategic national stockpile pushed out. We were expecting 2 semis full. We got 5 pallets, and then we received 2 pallets. So we have distributed all of those materials in this priority area. It has to go to hospitals and first responders first, long-term care, and then we've been using stuff or things that we collect that aren't necessarily medical grade that you could use in a hospital, like gloves and gowns and some other things that aren't like surgical ear loop masks, not N95, that we've been able to give to all of the congregate sites. And we've been pushing those out through the ADM board, Alcohol, Drug, Mental Health, and Developmental Disabilities, and trying to make sure that each of the group homes have the supplies that we need. And we sent spray bottles with bleach to teach them how to clean. And we've sent all of that stuff to all of the group homes and work closely with any nursing home that starts to have issues. We work closely with them and we set them up with the Ohio Department of Health, which is called an ITRAC meeting, which what happens then is they then get a telephone consult with the Ohio Department of Health. They agree on isolation practices. They agree on how to control the disease. And then if they need additional personal protective equipment or anything, we drop that off to them and make sure they have that material. We did receive 300 test kits at the health department, but we were instructed we are using those for long-term care to try to get that under control and to see if we can identify some of these homes or some of these long-term care facilities before they start to blow up and get a lot of cases. The problem is, anytime you have these congregate living situations with workers that go in and out and work at multiple facilities, you're going to have community spread. It's just very difficult to control. Today, if you watch the governor's call, the state of Ohio tried to report nursing home numbers, but had a very difficult time getting the accurate numbers. So now they're asking the locals to provide their numbers by Tuesday at 5 o'clock to the state so that they can get an accurate accounting of all of the nursing home cases and then be able to get that information up on their website and also decide if there's additional resources needed for those nursing homes. Testing. Again, the other huge issue that we've stumbled across is testing, in that the lack of the availability of supplies to test and test kits and reagents. One of the reasons we're so far behind on testing is the fact that most of the reagents and the swabs were made in countries like Italy and Spain and China, and their manufacturing was shut down. So it automatically created a huge shortage in the market of what was available. Therefore, it's been difficult to test. If we really want to get ahead of this, we have to have far-reaching testing to our most vulnerable populations. And currently, the CDC guidelines are that we can test first responders, healthcare workers, individuals in long-term care facilities, individuals that are in long-term care facilities, those individuals who currently work in a healthcare condition where they have been exposed to COVID. So really, we have not even started to do much community testing. Now, you may have heard that Rite Aid is beginning to test in about 10 different sites around the country, and they can do about 125 to 200 tests a day in Summit County, and they're using their South Main location, which I believe is either Coventry Township or Green, but they're going to be using that facility. Now, that is by appointment only, and it also only covers the first two priority areas, which are individuals that are hospitalized, but if you're hospitalized, you can't go to Rite Aid, you'd already get a test. Healthcare facility workers, those in long-term care facilities, again, can't really go to Rite Aid to get a test because you can't get out. And then they are going to add the group patients 65 of age and older. But all of these groups have to have some sort of symptom. But as you heard me say earlier, there aren't always symptoms that are present. So we really need to move towards mass community testing, and the sooner the better, because it will help us get a handle on just exactly where is and what is this disease. And the problem is, from the get-go, is that this disease has not been here before, so we don't fully understand how it works. And we don't really understand why. Now there's been some questions. At first, we were not doing any post-mortem testing, but now they have started to do a little bit of most post-mortem testing, because it appears as though some individuals, excuse me, some individuals don't have a lot of symptoms, develop cardiac symptoms much like a heart attack, and then die. And so they're desperately trying to find out if this is part of the COVID virus or not. So, so much is unknown. There's also been some literature about shedding of virus, that individuals who test positive continue to shed virus for 30 days. However, nobody really knows if you're still contagious and spreading that disease. And we won't know that until we can do some really advanced test every single person and find out what they have. And that's about the only way we'll get ahead of this. Now, the last thing I want to comment on, because I don't want to take all of your time, but the last thing is that, you know, we are going to start some sort of a slow rollout of opening. But I can tell you, past, you know, historical lessons learned, we always see little bumps in the flu right now. This is about the time, April to May, we can see a spike in regular old flu cases. We have not seen that this year at all. And it's because nobody is around anybody and they aren't able to spread the disease. So we are going to have to think very differently moving forward about how we conduct ourselves in public until we get a better handle, a vaccine or something. There has been some literature that says this virus has mutated like the regular old flu does. You know, the regular old flu vaccine doesn't work 100% ever. And it's because viruses can mutate. And when viruses mutate, they then change forms. And so there's been a little bit of COVID-19 that has mutated as well. We also don't know that if once you've had it, you're immune. Like once you get the regular old flu, chances are you won't get it again that season, but it doesn't mean the next year, if it mutates, that you won't get it again. They also believe COVID will be back in the fall with a vengeance. And so we need to think very proactively how we're going to start protecting vulnerable populations, nursing homes, neighborhoods which suffer from other social issues with not having resources, not well resourced, may not have access to medical care. We need to really start thinking strategically about how our response looks going forward, because this will not go away anytime soon. And I know a lot of folks are going to say that, you know, it's really hard to measure something that didn't happen. And if we get ahead of this, which Ohio has gotten ahead of this, we are nowhere near New York, where some of these other communities have been, and they have struggled. And we really need to get ahead of this with testing and identifying those populations at risk and doing everything we can to protect everyone. And just one more last thing I want to say, because I know it's really difficult if people have little kids and grandkids and they want to see their children, they want to see their grandkids. But I have to tell you, kids are really thought of as being a carrier that is asymptomatic. So if you have older parents, I would say, or anybody older, that you really need to be careful around little ones, because they have kind of been showing that they are asymptomatic carriers. And that's all I'm going to say right now, because I could go on all night and bore you to death with the COVID logistics. But I want to be able to answer any questions you might have or find out something if I don't know it.
Thank you so much, Donna. I actually do see Councilwoman Amobian has a question.
Yes, thank you very much, Margot. Donna, thank you so very much for that report. It was pretty thorough, and we certainly appreciate all the information. I personally think, and everyone I've talked to, think that the governor and Dr. Acton have done a superb job in Ohio. Let me just ask you this. You didn't talk about the age range. You did break down the race as best you could. And I'm hoping that eventually we will have definite numbers of those individuals as you break out racially. But what is the age range? And the second question I have is, why were these two communities chosen, Coventry and Greene, as opposed to the inner city of Akron?
Yeah, I have to tell you, Linda. Let me answer the first. The age range is 5 years to 97 in Summit County.
The deaths?
At the state, at the state, it's in the state it's something like less than 1 year of age to like 104. But in Summit County, our age range is 5 to 97. And thank you for that. I forgot to say that. I have to tell you, there's always lessons you learn from these sorts of situations. What doesn't kill you makes you stronger, is what my mother used to say. But I have to tell you, no one knew anything about these Rite Aid centers being set up. We got an email on, what's today, Monday, Friday, that said they were going to go live. They wanted us to know, just so they could start looping us in. It happened very quickly. They said they were notified on Thursday night from the federal task force that they were to mobilize. They picked sites that had the best logistical situation for the operations. The biggest parking lots, the biggest is what we were told. I asked if they were being paid, if they got money to do this, and they said no, that Rite Aid was not being compensated, but they were being given the tests to use for this. And they're using that self-nasal swab. So what will happen is you'll sit in your car, they'll give you the test, you'll swab your nose and put it back in the wrapper, and they'll send it away. And we had no say in any of this. No one at the nobody knew. I can honestly tell you, it was like you could have picked me up off the floor at 7:35 in the morning. And it was part of the federal task force, COVID task force, working with like Walmart. Allegedly, Kroger is doing it in areas where Rite Aid isn't. So they were pretty much told, man up and do it, is what they told us.
Well, thank you very much for that.
Mm-hmm. Yeah, we didn't like it either.
Yeah, I mean, considering that Akron is the largest city in the county of Summit.
Thanks for Donna at this time.
Well,
Councilman Swirsky. Go ahead, Donna.
Well, I just want to say, I think they thought they were in Akron. I think they thought that was an Akron site until they realized the address was Coventry or Greene. They didn't know that. They thought it was Akron.
Wow.
Okay, thank you so much. Councilman Swirsky, did you have a question? Okay, maybe not. Any other council members have any questions for Donna while we have her on? Councilman Fusco?
Yes, thank you. Yes, thank you again for that presentation and all the information. My question is, you had mentioned preparing for the fall, thinking about the fall, and what the expectations are from your side. Do you have any recommendations or anything that we should be thinking about now in terms of preparing for that, for the fall? Any ideas whatsoever, things that we should begin thinking about?
There's a couple, and I think that's really a thing we should all start thinking about. First of all, if, and this is a big if, but we have been told on some fronts that there could be some sort of a vaccine available for first responders in the fall. And there may be some sort of, and you know, this is sort of just rolling out every day, something different. But I think we need to think about what mass vaccination clinics would look like and how we can facilitate getting those done if in fact we get a vaccine. The other situation is that we're going to have to think long and hard about these mass gatherings. And I know that the fall is a lot of sporting events and folks really look forward to, you know, any number of events, but mass gatherings are going to be difficult at best for a while until we get some way to figure out just exactly how to control this, whether it be a vaccine, social distancing, hand washing, mask wearing. You know, the thing with mask wearing is, though, it doesn't protect the wearer from getting sick. It protects it just protects anybody that's closer to you than 6 feet from getting a moisture droplet off that you might cough. But it really isn't what it is. And that's why when we were new at this and it was just hitting like crazy, we were having so many healthcare workers affected because it was difficult just to get our heads around just what kind of disease protocol do you need to use, just what do you have to do to keep folks safe. And now that, you know, you get to a point where the workers kind of get used to it, and so everybody uses better practices, and so we're hoping those numbers will start to level off and we won't see the numbers. The other thing I think we're going to have to think about is what happens with these very vulnerable populations. You know, we have to really think about how long, literally, can somebody who relies on that paycheck go without money? And what are we going to have to do to put? And I think we have to, I know there's been all sorts of stimulus, I think, but we really are going to have to think about, if this goes on long term, how do we protect our most vulnerable citizens, individuals that we know already can suffer disproportionately in our population? And we're going to have to really strategize about how do we do that outreach.
Thank you.
Okay.
Thank you.
Thank you so much. Councilman Swirsky?
Yeah, I don't know what happened. I was talking last night. Mrs. Scota, I'm really pleased to hear, because I know there's been concerns about the number of people ill in long-term care facilities. So I was really pleased to hear, and deaths at Rocky Knoll and other places, that you are working with the Ohio Department of Health on education aspects, as well as making sure they have all the equipment that they need to address the problem.
Right.
Okay, so and I wanted to know what you think about the president's May 1st rollout date. You want to speak to that? If it sounds like we don't really have the testing that would be needed to be able to prevent it from kind of backfiring on us.
Yeah, that's my greatest fear, is that if we don't have this testing, yeah, I think that without testing, we are going to end up with a big spike again. No one knows if COVID circulates all year. You know, the regular old flu bug kind of comes and goes, and we know that from experience, but nobody knows if COVID's here all year. And they're starting to think it might be one of those things that's around always. And then having any kind of underlying health condition, the very old, living in a congregate site, living in close quarters. I mean, folks in New York City live very close to each other. And look what's happened in New York. It's been very difficult. Plus, you know, I think Linda said that we went quick and, you know, we shut things down quick. As painful as that is for people, we shut down things quick. So yeah, I mean, it's going to be a journey. And I think that if we open on May 1 without testing, we better get ready for another surge, because the whole idea was to keep the hospitals from getting overwhelmed. And I can tell you, they made sacrifices to make sure they didn't get overwhelmed. When they stopped all elective surgeries, when they did everything they had to do to save PPE and to make sure they weren't overwhelmed, that is a financially unsustainable model for them. Because, you know, we only pay hospitals if they do something to somebody. And if they're not doing that anymore, they're not going to make the money they need. And they're not going to be able to keep operating. And so we need to think about, they made sacrifices, the community's made sacrifices, everybody has sacrificed so much so far to try to get this under control. I would hate to see it all end because we were in a hurry. But I'm very sensitive to how painful it is for people.
Donna, thank you. Just one last time, any other council members have any other questions before we move on to our new legislation? Seeing none, Donna, we just want to thank you for taking the time and sharing such great information with us. We want to thank you for all your hard work and dedication and helping everyone here in Summit County remain safe.
Well, thank you kindly. And any one of you, if you have anything, you can call me at any time. And please, we'll get back to you as soon as we can. So just give us a call.
Thank you, Donna.
But I appreciate all you've done because I know it's been hard on you guys too.
Thank you.
Thank you. I'm going to hang up now and disconnect.
Okay.
All right. Thanks. Bye-bye.
Thanks. Bye. We'll now move into our new legislation. We're going to start off with item number 2. We're going to ask clerk to read it in.
Item number 2, offered by Councilman Malik. Resolution recognizing and honoring the life of Dan Spack and declaring an emergency.
Councilman Malik.
Thank you. I just wanted to bring in this resolution. Many of you may have seen in the newspaper, but Dan Spack, who was the engineering and robotics teacher at Firestone, passed away unexpectedly last week. And it was a significant loss for the Firestone community. He had such an impact on he had such an impact on so many people. I had him as a teacher, but so many people throughout the Firestone community. Sorry, I don't know what's going on. Anyways, and the one thing that I wanted to say is that our community is full of people like this, full of people who spend so much of their lives in service of other people and mentoring other people and making this the beautiful community that we live in. So I just, I wanted to take this opportunity to thank one of them.
Thank you so much, Councilman Malik, for bringing forth this resolution. Councilman Swirsky.
I appreciate what Councilman Malik did here. Also, I knew Mr. Spack when I taught at Firestone. He was a very good and decent person. He was a great teacher. He was very accomplished and recognized by his peers as someone who had a lot of expertise in very technical matters, engineering, computers. But he also had this very human, approachable side to him, always available both to the students and to the staff. So he wasn't alone, though, as Councilman Malik pointed out. There are a lot of people out there every day teaching in the Akron Public Schools who are good at what they do, and they're also just really good, decent human beings.
Thank you, Councilman Swirsky. At this time, Councilman Fusco, do you have a motion? Oh, we have one other question before we move into a motion. Councilwoman Amobian.
Councilman Malik, for bringing this resolution in. As a former school board member, I can tell you we've always had very strong staff at Firestone High School, and certainly Mr. Spack was one of them. Thank you for this, and appreciate acknowledging his contribution to our students. Thank you.
Thank you, Councilwoman Amobian. Councilman Fusco.
Recommend we suspend the rules with a favorable motion.
Councilwoman Amobian, do you want to second this motion?
Yes, I second it.
Roll call.
Baylor.
Aye.
Connor.
Aye.
Freeman.
Aye.
Fusco.
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Passes 13-0. Item number 3, offered by President Somerville. Resolution declaring it necessary to improve US 224 between the termini of Kelly Avenue and Hilbish Avenue by resurfacing and declaring an emergency.
Chris Ludlow.
Committee. This resolution is a resolution of necessity to improve 224 from Kelly to Hilbish. This is an ODOT resurfacing project. It's a $1.5 million project that they were resurfacing this part of the roadway.
Thank you so much. Do we have any questions for Mr. Ludlow at this time? Seeing none, Councilman Fusco.
Recommend a suspension of the rules with a favorable report.
Thank you. Councilman Lombardo, would you second that motion?
I second that motion.
Thank you. Roll call.
Taylor, Baylor,
I'm sorry, did you hear me?
I'm sorry, I'm getting a lot of feedback. Baylor,
Aye.
thank you. Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Thank you. Passes 13-0. Item number 4, offered by President Somerville. Ordinance declaring the necessity of, determining to proceed with, and levying special assessments for the improvement of certain streets in the city by constructing, reconstructing, and repairing concrete sidewalks, driveway approaches, curbs, retaining walls, and installing roof drain pipes, all in accordance with petitions submitted by property owners under the 2018 City Sidewalk Program and declaring an emergency.
Mr. Ludlow.
Thank you, Council President and members of council. Yes, number 4 and number 5 are both the assessment legislations for the sidewalk program. This first one that was just read in was the 2018 program, and all these were submitted by homeowners to improve their sidewalks.
Okay, thank you so much. At this time, do we have any questions for Mr. Ludlow? Seeing and hearing none, Councilman Fusco.
Yes, I'd like to recommend a favorable report with suspension of the rules.
Okay, and I'm just going to pause just right there. I did see Councilman Lombardo's hand go up. Did you have a question?
Yes, I did. I just wanted to know or ask Mr. Ludlow, when we passed, I believe for this year's budget was around $500,000 for the sidewalk program. This piece of legislation was for 2018. Was that the request that came in 2018 that will be taken care of obviously this year?
These requests, sir, were probably put in 2016 or 17 and then performed in 2018. So we did not finish the program until 2019. That's why we're levying the assessments now. Typically, it's a year after the work's done.
Okay. Okay, thank you.
You're welcome.
Thank you so much. We do have a motion on the floor. Can we get a second by Councilman McKittrick?
Second.
Thank you. Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Item passes 13-0. Item number 5, offered by President Somerville. Ordinance declaring the necessity of, determining to proceed with, and levying special assessments for the improvement of certain streets in the city by constructing, reconstructing, and repairing concrete sidewalks, driveway approaches, curbs, retaining walls, and installing roof drain pipes, all in accordance with petitions submitted by property owners under 2019 citywide sidewalk program and declaring an emergency.
Mr. Ludlow?
Thank you, Council President, members of council. Yes, this was the 2019 program that we finished up last year in the fall. And this work probably was requested by residents in 2017 and maybe a little bit in 2018. So the work was done last year and we are now doing the assessment legislation for that.
Okay, thank you so much. Any questions on this item? Seeing and hearing none, Councilman Fusco? Councilman Fusco?
Can you hear me okay?
Yes, I can.
I'd like to recommend a favorable report with suspension of the rules.
Okay, we have a motion on the floor. Can we get a second by Councilwoman Connor?
Second.
Thank you. Roll call.
Baylor, sorry, I went too soon. Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Passes 13-0. Item number 6, offered by President Somerville. Ordinance authorizing the purchasing agent or her designee, after publicly advertising for bids, to enter into a contract or contracts for the purchase of a used front-end loader for the water reclamation facility and declaring an emergency.
Mr. Ludlow?
Thank you, Council President and members of council. Down at WRF, our water reclamation facility, all the influent as it comes into the plant goes through grit screens, and these grit screens, they roll off into a dumpster. So it's all the debris, the solids that we remove down at the plant. Currently, we're using a 1994 Ford truck that was converted to move these dumpsters. They're roll-off dumpsters in and out. And as you can imagine, especially in the fall, when we have all the leaves, we get a lot that go down the sewer and we have to move these dumpsters numerous times a day. So we didn't see it was prudent to purchase a brand new unit. Tom Smith, as you all know, did a lot of research and we have found a used one we'd like to buy to replace that one from 1994.
Thank you so much. At this time, do any of our council members have any questions? Seeing and hearing none. Councilman Fusco?
Yes, thank you. I'd like to make a favorable motion with suspension of the rules.
We have a motion on the floor. Can we get a second by Councilman Swirsky?
Yes. Second.
Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Item passes 13-0. Item number 7, offered by President Somerville. Ordinance ratifying the actions of the Director of Public Service in contracting for the emergency purchase of 2 UPS backup power units for use at the water reclamation facility, authorizing payment therefore and declaring an emergency.
Mr. Ludlow?
Thank you, Council President, members of the committee. As you remember, a few weeks back, you allowed us to enter an agreement to purchase these UPS. These are to purchase the two UPS, the uninterrupted power sources for WRF. In the event that we'd have a power outage, this keeps all our controls from shutting down. So our system, when the power comes back up or the generator starts, we don't have an interruption in power.
Thank you so much. Are there any questions from any council members? Seeing and hearing none, Councilman Fusco.
Yes, thank you. I'd like to recommend a favorable motion with suspension of the rules.
Thank you. We have a motion on the floor. Can we please get a second by Councilwoman Baylor?
I second.
Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Passes 13-0. Item number 8, offered by President Somerville. Ordinance accepting various interests in real property located on or around Canton Road to facilitate the completion of the Sum 91 Canton Road Market Street project, authorizing the Director of Public Service or his designee to enter into related agreements, authorizing payment for the same, and declaring an emergency.
Mr. Luddle?
Thank you, Council President and members of council. Yes, part of the Canton Road roundabout, we had to acquire a little bit of land from property owners in that intersection. This property owner is at 325 South Canton Road, which is actually on the southeast corner of Paxton and Canton Road, kind of catty corner to the Walgreens. So there's a little sliver of property we need to acquire, and we're going to pay the property owner appraised value for that land.
Thank you. Are there any questions from any council members at this time? Seeing and hearing none, Councilman Fusco.
Yes, I'd like to make a favorable motion with suspension of the rules.
We have a motion on the floor. Can we please have a second by Councilman Neal?
Second.
Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Item passes 13-0. Item number 9, offered by President Somerville. Ordinance authorizing a conditional use to construct a motor vehicle and truck leasing, rental, and sales business at 937 East Waterloo Road and declaring an emergency.
We are going to refer this item for a public hearing, tentatively scheduled for May 18th.
President, do you need a motion on that to refer that item, and do we vote on it or just refer?
Yeah, let's get a motion to refer it, please.
Yeah, I'd like to make a motion that we refer and advertise for a public hearing on May 18th.
Thank you so much. We have a motion on the floor. Can we get a second by Councilman Freeman?
Second the motion.
Roll call.
Baylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
The motion passes 13-0. Item number 10, offered by President Somerville. Ordinance authorizing the Director of Public Service or his designee, after publicly advertising for bids, to enter into a contract or contracts for the replacement of the existing fluorescent light fixtures on Dan Street with LED fixtures and declaring an emergency.
Mr. Luddle?
Thank you, Council President and members of council. we've done light audits at a lot of our facilities, and we had found up at the Dan Street facility, we had 240 fluorescent lights, and we are going to upgrade them to 240 LED fixtures. So we're going to place in kind, which is going to save a considerable amount of power to that facility.
Okay, thank you so much. I do see that Councilwoman Amobian has a question.
Just curious, Luttle, I'm just curious. The lifespan of one of these light LED fixtures replacements is what? I know you've given us.
Well, fluorescent lights, their life and they put out a lot of heat and generate a lot of electricity, where the LEDs burn a lot cooler. So they put off less heat, less power, and they tend to last at least double what a fluorescent light fixture the light lens lamp lasts, excuse me. I'm sorry, I didn't hear that.
Councilwoman Amobian, we can't hear you.
How long the lifespan? Did you get that?
The lifespans of the lamp, at least more than 10 years.
Oh, okay, great. Thank you.
You're welcome.
Councilman Neal?
Thank you, Madam President. Mr. Luttle, can we get a report on what the, how many lights have been switched over and what the estimated savings is, cost savings per year?
Sure. Are you talking buildings, facilities we own?
If it's possible, or everywhere we've made this type of adjustment, just so we could get an idea of the cost savings or how long it'll take for us to recoup the savings. I don't know if they're still extending any type of credit or anything to cities anymore that do this. I don't know if those still exist, but just so we could get an idea of the savings that's coming from this new efficiency.
Yeah, to answer your one question, we do still receive a rebate from the power company, but it's a lot lower than it was, let's say 5 years ago. So okay. We do receive that, but I'll get you, it's almost gonna have to be building by building. What we have looked at is putting some energy saving, like motion sensors in offices. So when they're not occupied, they go off automatically, which actually would save some money if we didn't even change the LED. But probably our bigger savings is the parking decks where the lights are on, 24, not the ones underground, they have to be on 24/7 because people occupy them. So we're looking at doing some upgrades there too, but I'll get you some information on what we have done to date.
Thank you, sir.
You're welcome.
Are there any other questions? Seeing and hearing none. Councilman Fusco?
Thank you. Thank you. I'd like to make a favorable motion with suspension of the rules.
We have a motion on the floor. Can we please have a second by Councilman Malik?
Second.
Roll call.
Taylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Item passes 13-0. Item number 11, offered by President Somerville. Ordinance authorizing the purchasing agent or her designee without the formality of publicly advertising for bids to enter into a contract or contracts with NetMotion for the purchase of new licenses and renewal of current licenses and declaring an emergency.
At this time, we have some comments coming from Deputy Mayor Charles Brown.
Good afternoon, Council President, members of Council. NetMotion licenses are essential for the operations of the computers the officers use in the cruiser. And in fact, any mobile device being used and connected to the city's network requires a NetMotion license. We're looking at trying to purchase renew 318 of those licenses. and additional purchases of 42 for about $30,000.
Do we have any questions from any council members at this time? Councilman Malik?
Thank you, Deputy Mayor, for the explanation. I just had one question. I know some of these licenses, I believe, are going to be charged to other jurisdictions. Do you know how many of those roughly?
Yes, University of Akron, Summit County Sheriff's Department, and the fire department, our fire department so far.
Thank you very much.
Are there any other questions at this time? Seeing and hearing none. Councilman Fusco?
Yes, thank you. Thank you. I'd like to make a favorable motion with suspension of the rules.
We do have a motion on the floor. Can we please get a second by Councilman Kamer?
I will second that motion.
We have a second. Roll call.
Taylor,
Aye.
Connor,
Aye.
Freeman,
Aye.
Fusco,
Aye.
Kamer, Kamer,
Oh, aye.
thank you. Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Swirsky.
Aye.
Passes 13-0. Item number 12, offered by President Somerville. Ordinance authorizing the Director of Finance or his designee to enter into a contract or contracts with Workday Incorporated for the purchase of financial management and human capital management software and declaring an emergency.
Thank you so much. And we actually have our Director of Finance, Steve Fricker, who will present on this.
Good evening, members of council. Can everyone see and hear me?
Yes.
Okay, thank you. So this legislation is to replace our existing Banner and PeopleSoft software with a software application known as Workday. And I do have a little bit of a presentation that we can go through. I'm going to share my screen right now. Okay, can everyone see my screen?
Yes.
Okay, thank you. So before I go through the presentation with the information about the software, what I'd like to do is talk a little bit about why we are seeking to go forward with this legislation right now in the midst of the COVID situation that we're in. We do have a number of reasons why we think it's important to continue with this project this year. So this project is something that we've been looking at for a couple years now. I do believe we talked about it at budget hearings in March, that we talked about that we would be bringing legislation this spring to replace our existing financial and HR software. So we've been going through this process to replace these two systems that are now over 20 years old. So the two systems that we have, Banner was put in 1997 and PeopleSoft was put in 1999. And they were done because we had Y2K issues, which is probably a term you haven't heard in a number of years. So that's how old these applications are. They were put in to deal with the Y2K problem. So we've been spending the last few months really analyzing two different software packages. We made our determination about a couple months ago in terms of which direction we wanted to go, and that is with this Workday software. And we do think it's important to continue on for a number of reasons. And the first of which is the security aspect of this software. Because it is a cloud-based software, it's much more secure than the existing client server applications that we have right now. So with those applications, we have to put up our own security and maintain it on our own servers, which is costly to do for a city to do that where you have to put in these firewalls and security type software to keep, hackers out from your system, where it's much more cost effective for a larger company that deploys their software in a cloud-based format. It's much more cost effective to spread that cost out over those various clients that you have. And in addition to that, it just is much more secure. So the Workday Corporation or the Oracle Corporation, the two packages that we looked at, are billion-dollar corporations that are able to have much more robust security than we could ever have here at the city. So, and this is a vulnerability that was identified back last year when we had the hack, and we got a report of our current network situation from the Ohio National Guard. And this is a key area that they identified as a vulnerability for us, were these core applications on our system. So we do think it's much safer to have these deployed in the cloud than what we currently have. And every day that we go by with our current network infrastructure is a risk that we are taking. We also have some upgrade costs for our two existing systems that are coming up this year that we've been putting off because we had the plan to move forward with this new application this year. So both of those projects are in excess of $100,000 each. Like I said, we've been putting those off, but if we postpone this software project, then we would have to apply those patches, which would be anywhere from $200,000 to $250,000 between the two applications. And that's money that we would be pouring into applications that are really end of life. So we don't want to make that investment. We think it's much better to move forward with the new software now and apply those dollars towards a modern application that we'll be using for the next several years. There's also going to be some offsetting cost savings from this new application. We'll get into that a little bit later in the presentation. But because this software has so many new features and is a much more modern application, there are some cost savings that will be realized throughout the organization in terms of efficiency type savings that we will realize. So there are some offsetting costs, and as you'll see, this system will recover its investment, will recover its costs in a relatively short period of time. We also got very good pricing on this application that really is only good for the time period that we have worked out with the software vendor Workday. So we were able to secure the availability of their consultants to do the install, which we're getting at a much cheaper cost than if we went to some type of third-party implementer. In fact, when we looked at the two different systems, the implementation cost for the Oracle system using a third-party implementer was more than twice what we're going to pay for the implementation of this system. So we feel like we'd be losing that opportunity to put this software in at a very reasonable price if we delay it until next year. And then finally, and I think most importantly, in terms of the reasons for moving forward now, would be the way that we're paying for this project. So we are paying for the subscription to this product out of our IT fund, largely with fund balance that was left over from last year. And then we're paying for the implementation as part of the capital budget by issuing bonds. So by not moving forward with this project, we're really not freeing up any dollars that would be available for other areas of investment in the city. These dollars were specifically earmarked and are in specific funds where they're going to be used towards this application. If we didn't do it, we would not really have those dollars available for other purposes. So they are sitting there, they are waiting to be spent on this application. Okay, I'm going to go into the presentation now. Okay, so some of the challenges we face and the reason why we are looking to upgrade the software, as I mentioned, it's over 20 years old. We have out-of-date client-server architectures on those. For our HR process of managing our employees, there's a lot of manual effort put in. There's a lot of paper-based processes that we still have within the city that this will eliminate. It's also difficult to get metric reporting out of our existing systems. There's so many different systems, and it's not easy for the managers and city employees that don't have, a specific IT background to get metrics out of the existing systems that we have. This system will allow us to do that. Okay, in terms of the process that we looked at in order to select these software applications, as I said, we started this process a couple years ago. So our current HR payroll system is called PeopleSoft. The upgrade to that, or the successor application to that, is this Oracle HR Cloud, which is one of the two applications that we looked at. Its principal competitor was Workday. So we kind of focused in on those particular two applications in terms of the software vendors that we had come in and demonstrate their products for us. If you look in the bottom left part of this slide, and I know it's kind of hard to see, it's kind of small handwriting, but the two applications, there's a IT publication called Gartner that rates all different types of software, and these two packages that we looked at are the ones that are identified as being the best combination of being industry leaders and the results from implementing these pieces of software. So these are really two good pieces of software. And like I said, we focused in on these two right away. We also, so as we looked at these, and we probably had demonstrations for each of them that exceeded 1 week in time. I would say we had 50 or 60 hours with each of these applications, having them come into the city and demonstrate the product. We also then went and spoke with existing clients of each one of these applications, as well as a couple that were going through the process right now of implementing the software, just to get their feedback on what their experience was. Okay, this slide is just to point out some of the major clients, some of the major corporations and other governmental entities that are using Workday. So there are a large number of public sector clients, and they range from states, cities, counties, higher education, colleges and universities, as well as, obviously some of these companies on here are major Fortune 500 companies that also use the software. So this is a very well-established, well-proven piece of software that we're moving to. Okay, this is the components that we'll actually be purchasing with the software. So as we talked about, it's really replacing two systems, and it has two key components. So one is our human capital management, or HR. So this is going to manage our payroll, all of our human capital management, which are all of the our job titles, our positions, our compensation schedules, all those types of things that are associated with HR will be maintained in the system. And it will also have time tracking, which we really do not have in our current system. And that's made available because this system is a modern application and works with mobile devices. We can do things like time tracking, where basically when people arrive at work, they can clock in with their cell phone. And so there's a lot more data that's going to be consumed by this system and help us manage our employees better, manage our costs better. And then on the financial side, the core financials, this will be our transactional based system. So all of our expenses and revenues will flow through this system. All the transactions that we process in order to run the city will come through the system. It also has an expense module, which will replace our paper travel system that we have in place right now. So instead of filling out those part 1 and part 2 paper forms, this will all be an electronic process with electronic approvals. Again, it'll be a modern application that has modern workflows and replaces a lot of those paper processes that we have. It's also going to drastically modernize our procurement system. So you can do things like set up a shopping cart based store and supplies purchasing process. So Right now, we have this kind of antiquated system where we order through a storeroom catalog, and we have people in our storeroom that have to manage all those orders. This will literally be like going out to Amazon, clicking on your items and getting those items delivered to your office, all with the cost centers for each user that's logging into the system logged. So it's going to take out a lot of that paper manual process and replace it with a modern shopping cart type process. We also are going to have a grants management module, which we currently do not have with our banner system, which will allow us to directly pull the transactions that are reimbursable by granting agencies out of our system and bill back those costs to those agencies. So it'll be a huge improvement in terms of the timeliness of getting reimbursed for grant costs that we incur through a number of our different departments. Okay, and this is another look just at a little more fine-grained detail of the different components of this new system. And one thing I want to point out is all of these different areas right now, all of these different functions are being maintained by 15 to 20 different systems that all cost money, that all have to be maintained, that all have to be upgraded separately. This system will replace all of that with one system. And the other benefit of that is it will share information back and forth across these different areas much easier than it is now. So for instance, when we're doing our budgeting, we have to pull information out of our PeopleSoft HR system and transport it over into our budget database, also merge that with Banner cost data. This system will have it all in one place. So it will drastically improve our ability to share information between these different areas of operation within the city. Okay, as I mentioned, there are some offsetting cost savings to implementing this system. So Workday, when we were going through the process of evaluating the systems, Workday and Oracle for that matter, both provided us cost benefit analysis estimates on some of the offsetting cost savings to implementing these systems. So when you look at the software costs of all those 15 to 20 different systems that we will eliminate by implementing this system, as well as all of the efficiency savings that we will see in our purchasing process, in our HR process, those add up to a significant amount. Now, they came up with $5.1 million. Whether it actually amounts to anything near that amount, remains to be seen. They got these numbers basically by looking at our, the size of our organization, and, they asked us for some of our cost information for our existing systems. But I can confidently say that there will be a substantial amount of offsetting cost savings. And here I'm going to pull up this analysis, a 5-year cost benefit analysis. So based on their analysis, the payback on this system will be slightly over 1 year, and will ultimately result in net cash flows of over $14 million over 5 years. Now, whether we realize all of that or not, remains to be seen. But again, I can confidently say that this system will pay for itself, and it will pay for itself relatively quickly. Okay, and this is just a quick look at kind of the environment that we're in right now, where if you look at that graph on the left, that's what we're doing right now, that one that kind of zigzags up and down, as opposed to being a nice flat curve. There's a lot of talk right now about flattening the curve, everything that's going on with COVID. And that's exactly what we're talking about here. So instead of having these, upgrades that we have to do every 3 or 4 years and invest, some of the PeopleSoft upgrades that we do are over $1 million in cost. This spreads that out. So you have a nice, consistent investment in this system over time. And you don't have these giant peaks that crop up every 2 or 3 years of cost where you have to perform these upgrades. And then finally here, as I mentioned, right now, what we have negotiated with Workday is basically a 1-year implementation timeline. And this is that timeline. So our go live date would be April 1st of 2021. We would actually get started next month with this whole process. We have kind of planned around this from an investment of our city resources. Obviously with COVID, we have taken that into consideration. But we feel like this summer, the key people that need to be involved with this will have the time and resources to invest in doing this system implementation. So with that said, if there's any questions, I'd be happy to answer them.
All right. Thank you, Mr. Fricker. I do see that Councilwoman Amobian has a question.
Yes.
Questions, and two of them are very easy and the other one may not be. I thank you for your presentation. I think you've answered a whole bunch of questions, and this appears to be something that's going to get us into the 21st century at least, and for years to come. Will this replace staff, and approximately how many? That's the first question. The time tracking that you talked about, are we currently doing timekeeping kind of thing with staff?
So we have a little bit of timekeeping that we do within some of our service divisions. There are places that have some time clock, but it's not, it's in, a few divisions here and there. We do not have it widely available in our more office type environments like within City Hall. So it is something that we are looking to implement with this. So like I said, because this has that mobile capability, basically you can have someone sign in with their cell phone and it will track time based on that interaction with your phone or your computer into the system. So it is something that we are looking to do with this new system. In terms of replacing staff, the answer is over time, we feel like it will free up staff to either through attrition, not replace people as they leave, or and also free them up to do other tasks. So we do not intend to, as we acquire this system, lay off people because we've replaced their function with something that's happening on the computer. What we do intend to do is look at where it does generate efficiency savings and, repurpose those people to something else. And, as people through attrition leave the city, we would evaluate all those positions and determine whether now with this new technology, maybe we can forego replacing that person.
And my third question, Madam President, is, we talk a lot about the role of council, and we know that one of our major functions is to be an overseer, oversight of the budget. And I know we've talked a lot about being able to track what we spend and how we use money that comes in and all of that. Is there a way for council to manipulate this tool and get information without messing with your data, if that's clear? I don't want to mess with something that we shouldn't do, but it should be a way for us to go in and look at things and manipulate things to try to figure out what's going on with this line item or that line item.
What I will say is, so this will be our transactional finance accounting system. So it's not something that we would have council logging into and doing things with. Now, having said that, what this system will allow us to do is produce, more abundant and more robust reporting than what we can currently produce, and distribute that out to council that will provide more granular information than what we can currently provide right now. So what we can do is basically provide you with better information from this system, because it has a much more robust reporting capability than what we currently have.
Madam President, if I can follow up just with a little bit.
Yes.
Okay, just a quick question and a follow up. And I guess what I'm talking about, Mr. Fricker, we talk a lot about the savings that we get with travel and the funds we get from that, the money that's come back into the system with the workman's comp programs and things of that nature. If we could, is there any way that we could get that kind of information quicker and without a lot of pushback in terms of where do those dollars go? How do we spread them across the various line items and that kind of thing?
I mean, yes, I mean, as I said, this system does have a little bit better reporting capability than what we currently have. So we could produce reports on all of that we could make available to council.
Okay, thank you very much.
Okay, thank you so much. Are there any other questions from council members at this time? Councilman Swirsky?
So questions like what Councilman Neal raised a little while ago about energy use, would this system help track and the use and the cost of energy and help us plan or devise other ways to reduce our costs?
It would in some ways beyond what our current system is in terms of when we code, for instance, our electric bills and the way that those are coded when we pay the actual electric bill in our current accounting system, we kind of have limited descriptive fields available to describe each address location and do, robust reporting within our accounting system on each electric account, for instance, that we have. This system will provide for that and be able to report in much more detail than what we can currently get out of our current accounting system. So
okay.
yes, it will say, you will be able to better look at the cost from each of our locations in this system than what we can currently generate on from our banner system.
And possibly for other utilities?
Yes, for everything. So, so it would encompass our electric, our gas, our steam, our cable bills, our telephone bills, our cell phone bills, all those things. Yes.
Okay, thank you. Councilman Neal?
Thank you, Madam President. Mr. Fricker, thanks for the presentation. During your presentation, I noticed you mentioned several times about how cumbersome it is for you all to get information, and how this new system is going to streamline a lot of that and make it possible for you to be more effective and more efficient. Following up on the questions that were asked earlier, if we can look at, since we're going to make this significant investment of close to some $3 million over time, making sure that there is a component. I believe the two budgeting software, online softwares that we're looking at for council were less than $35,000. If you can appreciate how effective and efficient it makes it for your staff to be able to do their job and not have to look through different things, please be considerate of us on council at this time to look at, since we're making a significant investment, to put a software in place so that we can be more effective in doing our job. And as per our city's charter, we can do a better job engaging our constituents to take a look at the city's budget. I went online and looked at the state's online budget software. It's very effective to where you can follow and track where dollars are going. As has been mentioned, right now, council, we have the COVID dollars that have come in. We've got our regular budget that we're dealing with. We haven't even talked about the opioid dollars, $104 million of opioid dollars that have come in that are sitting with the county that we do and should have some input on. So please, if this does not allow us to track the budget and track the different savings in the year 2020, we need to make sure that as we're making this investment that we do that. But I also want to make note to members of council, I heard Mr. Fricker state that this is a cloud-based system, and it's because it is more secure. There's nothing that we can do that's gonna, we've already experienced having our system compromised. And something that most communities and businesses are dealing with now, since most people are working from home, is that added threat of the compromising of their systems, because most of us on our home networks do not have the way of protecting our systems. So I say that because I don't think we've made the investment on our legislative software yet. And it was said that that's going to be a server-based software. So Mr. Fricker's point brought that home to me as well. But I appreciate the reporting, the presentation that was given to us. I just hope that since we're making this investment at this time, that we take everything into consideration as we make these other investments as well. Thank you, Madam President.
Thank you, Councilman Neal. At this time, are there any other comments coming from any other council members? Councilman Malik.
Mr. Fricker, thank you so much for your presentation. And, you know, we can all see the amount of work that went into this. And, you know, I know that, you know, none of this is done lightly. I know that, you know, some of these big ticket things that we discussed in the budget hearings, it feels like a lifetime ago. I think it was just last month. But anyway, some of those things, you know, it raises the broader question of you know, what is going to go forward and what isn't. And I know that you all are hard at work on the reviewing this, and just was wondering, and I know that, you know, have been keeping updated, you know, with ward council people on different projects that impact their ward, and I appreciate that. But is there a broader update on how that work is proceeding?
In terms of us evaluating the remainder of 2020?
Yeah.
Yes, yeah, we are going through a process right now of meeting with each department, determining both from a contractual standpoint and from just a programmatic standpoint, items that you know, maybe that we could scale back in 2020 or even forego in 2020. So we are proceeding with that process right now. We've been meeting. I think we've met with about half of the departments. We've identified some, you know, some programs and items that we'll look to, you know, like I said, either scale back or not do at all in 2020. And those involve both, you know, contractual, you know, vendor type expenditures and, you know, some overtime areas, you know, that we've identified. You know, so we are looking at all that. So everything is on the table in terms of labor and vendor expenses.
Thank you very much.
Okay, thank you so much, Councilman Malik. Are there any other questions from any other council members? Any other council members have any questions? Councilman Fusco? Councilman Fusco? Okay, hold on. Now we can hear you.
Okay. Short of any other concerns or comments, I'd like to make a favorable motion with suspension of the rules.
Okay, we have a motion on the floor. Can we please get a second by Councilwoman Samples?
Second.
Roll call.
Miller,
Aye.
Connor,
Aye.
Freeman. Freeman.
Aye.
Thank you. Fusco,
Aye.
Hamer,
Aye.
Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Obian,
Aye.
Samples,
Aye.
Somerville,
Aye.
Gursky.
Aye.
Item passes 13-0.
Thank you so much. We'll now go to our portion of our meeting that we refer to as our public comment period. We just want to encourage all those who might be watching us live on YouTube. You can still participate in Akron City Council meetings during our public comment period. We just ask that you submit a written request at publiccomment@akronohio.gov. We do have one public comment, and we're going to ask for the clerk to read that in.
This is from D. No last name was given. How will these funds help businesses improve along main thoroughfare like Arlington Street? Buildings are being torn down, but what's been slated to replace them? Are businesses being encouraged to rebuild there? Loss of revenue, eyesores, and blight are all that remain. Don't take my word for it. Take a ride starting at Johnston and go all the way up to Triplet and Arlington. It's awful. Funds were available for the improvement of facades of buildings, but how many of those business owners were informed, guided, encouraged to imply by the councilwoman? Address the very visible and ongoing of problems specific to wards that need help. First things first. I encourage the councilwoman in Ward 5 to carry the same enthusiasm she had while attempting to address issues on the west side in Ward 4 last year. There are hardworking people in the neighborhoods and deserve better. It's okay to be ambitious, but be faithful over a few things and other doors will open. By the way, this goes for everyone serving. I've lived and worked in several areas of the city, so I'm speaking from experience and firsthand knowledge. An example of great progress is Ward 3. The Kenmore area is another. I've lived in Ward 5 for nearly 30 years and seen next to no progress. Resuscitate the heart of the community and watch everything else around it blossom and grow. This was forwarded to all council members.
Thank you so much, Dee, for submitting your public comment, and we will make sure that gets forwarded to Councilwoman Samples. At this time, is there anything else coming before this body? Councilwoman Samples?
Thank you, Madam President. Yes, that's Ms. Lewis. I've spoken to her, and Arlington doesn't just belong in Ward 5, so it is what it is. You can't expect people to build businesses in areas where the crime is high. That's what I told her when I talked to her. People are shooting and killing each other. We can't expect people to want to come and build a business there. So until we are able to do something about the crime in that community, all the way up and down Arlington Street, all the way up and down Johnson Street, nobody's going to open a business there. And I've told her that time and time again. So it's unfortunate. She feels like I've got more enthusiasm for Ward 4 and 5. Apparently she's not been paying attention. That's all.
Thank you, Councilwoman Samples. Is there anything else coming before council at this time? Councilman Fusco?
Yeah, I'd like to make a motion to adjourn.
We have a motion to adjourn. Can we have a second by Councilman Sworsky? All in favor at once, signify by saying aye.
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 The ayes have it. Before we adjourn though, council members, please, and I meant to say this prior to, our next meeting will be on May 4th. In the month of May, in light of Governor DeWine opening back up government in May, we will still continue to meet on Zoom, and we will meet every Monday in May. So our next meeting is May 4th. In the month of May, we will meet on Zoom, but we will meet every Monday. So we have a motion for adjournment, all in favor. So you are adjourned. Have a nice night.
Thank you. This concludes the live broadcast of Akron City Council. Margot Somerville presiding.